Last time, those of you who are with us know that we were linking together some of the issues in COVID and also in Black Lives Matter. And that built up an awful lot over the weekend, obviously with all the protests and opportunities to engage via the media in a number of local radio stations as well as national media on, can you protest and also be safe in the face of COVID? And I think my line, and I see that that's been taken by many others, is that, yes, we're learning to live with COVID as a constant presence. And part of that is being able to assemble and protest. And so that has been a very consistent line that we've taken. And I'd be very interested to talk about that if anybody wants to. Today, the focus is on learning to live with COVID. I want to talk about where I'm seeing the pandemic moving to. Greetings to Paul Polman. Thank you for joining, Paul. Just want to say where I think the pandemic is moving. Also, some of the issues that I see different countries are facing. I'm going to go in detail to some material from the United States, from Brazil, from New Zealand, a little bit also from Somalia and Kenya, and then like to talk about Nepal, Sweden, perhaps Argentina, perhaps Tanzania. We'll see how we get on. If any of you have got country examples that you want to talk about, today is very much going through and sharing country examples of challenge and examples of solidarity. And we'll use the same approach of, you will put comments please in the chat, and then at intervals we will stop. And if you'd like to come in and make quick remarks, please try to restrict them to a couple of minutes if you can, and then that means we can get lots of people joining. It's absolutely brilliant that you do this. So let me just start straight away. I'm not going to do a long introduction. I have to tell you that I reviewed the numbers that WHO has produced over the last few days, and it's quite clear that even though we know that not every person with COVID is being tested, the numbers of new cases are rising at an extraordinary rate. This pandemic is not over by any means. In fact, as I've said several times before, I feel we're still at the beginning of learning to live with this virus, beginning to understand what it is to have a continuous COVID presence. And so I want to stress that learning that we're doing is something that we're doing all simultaneously. And in a way, what I want to do in today's briefing and continue to talk about in subsequent briefings is what that learning experience is like. How many heads of state and government, heads of business, heads of civil society, heads of universities, how many of them are actually taking on board that we have got to learn to live with this virus and that it is a real threat, and a threat that makes a difference to our lives. And if they're not actually internalizing this, what can we all do to help them to take it on board? And so let's just think a little bit about what all this means. I've been looking very carefully at the news from New Zealand. The country declares itself correctly, I think, COVID-free. But they are going to have to continue to be on the lookout for the virus. And they know that even if they put in the most strenuous border checks, that they're still going to get the virus coming into the country. They can't just wall themselves off and mothball themselves. That's not the future. And so what are they doing? They are making certain that every citizen in the country knows about COVID, knows about the threats that it can cause. But they're making sure that every public health authority in the country knows what they've got to do if there are reports of COVID. And they are really making absolutely certain that it is understood. Sorry, I've got a problem with my phone.
It just needs to be on silent.
What?
It just needs to be on silent.
Yeah, it's done. So in New Zealand, they have got the whole public health system organized. They're tracking right across the whole country, and everybody knows who they've got to be in touch with if they get ill. It's knowing, because there is granular organisation of public health services, makes a huge difference, because then it means that if COVID arrives, then it can be dealt with, and it can be dealt with properly. So I'd just like to really stress to you that this is an important departure, that we've now got countries showing that they can get ahead of the virus. So let's move to a little bit to a couple of other countries and think about how they are dealing with the constant threat of COVID. In Germany, it's all about trying to make certain that if there are new outbreaks that emerge, that there is capacity in the country to close them down quickly. And that's included working with workers in meat factories and the like. And I mean, I'm very impressed with the way in which they're operating. In Ireland, I mean, I'm going to be talking to Irish legislators later this week. Again, they are all organised to be ready to deal with the COVID threat and to deal with it if it comes back. They're putting a lot of effort into making sure that their accommodation, residential accommodation for older people is safe, and that people are not going to be subject to a high risk of death. It's all down to whether or not there is strong commitment by the head of state or government into taking this seriously. Whether you're Leo Varadkar working in Ireland, or you're Jacinta Ardern, the Prime Minister of New Zealand, you are providing the kind of leadership to your people that says, this is a threat, we're going to live with it as a constant presence, and we're going to make sure that all of our society knows how to get on top of it and get ahead of it. Because if you don't, then you get a situation like we're finding in, for example, the United States, where there are still coronavirus outbreaks that are being traced to funerals, fast food restaurants, cruise ships, Navy vessels, nursing homes, food processing plants, particularly meat plants, and prisons. All places where people are packed in close quarters with little opportunity for social distancing, and where there has not been a clear direction to the population that actually social distancing or physical distancing really matters. And this has to be incorporated into the culture. And so here's the situation in American jails or prisons. 59,000 inmates in American jails have been infected, and at least 557 inmates in American jails have died. And many are frightened and frustrated by what's happening. And so we go to a particular county in Tennessee called Truesdale. 7,800 residents in that county exist, and out of them, 1,400 have had the virus. And where is the virus? It's in a state prison in that particular state. And also it's in a meat packing plant nearby. And so this, inside the United States, at least according to my information, because there has not been a nationwide effort to help people to get ahead of and conscious of what this virus means for their lives, it's now become embedded into these settings, whether they are prisons or meatpacking plants or the like. And that is going to take an awful lot of time to deal with. You can't just suddenly sort of wave a magic wand and the COVID goes. It actually means changing what happens inside the correctional facilities. It means changing the work patterns within meatpacking plants. It means working with these big meat companies who were the ones who've been asked by the president to keep producing meat and to be cutting up carcasses. But they've got to develop new ways of running their plants in order to reduce the risk of infection. And the prisons have got to develop new ways of looking after inmates, because otherwise the COVID will stay there and it'll be very, very hard to remove. So let's make a shift to India. So I've been looking at the situation in India, and we're seeing very clearly that the COVID is primarily in the slums. I've told you that it's in Mumbai, in Ahmedabad, in New Delhi, in Kolkata, in Chennai, and in other cities as well, but perhaps those are the ones where it's most pronounced. And it's very hard indeed to help people inside these very dense populated areas to avoid and not go on being at risk of COVID. And so you do get illness and you get death in these areas. But now in India, there's been a situation in the Supreme Court where the government has been told that simply allowing migrant workers to leave the big cities and to walk back to their homes and to run the risk of taking COVID with them into the countryside, that's got to stop, and that the government has got to lay on transport to take people back to their homes. But then let's say you're in Nepal, let's say you're the Minister of Health of Nepal, and you're finding suddenly that there are a lot of people coming into Nepal from neighboring India across a border that is open, and they've got COVID. And so they're bringing COVID into your country, but you have very, very limited healthcare capacity. You have very limited testing capacity. And so you are then becoming a new COVID center, a very urban come rural COVID center. And you get really nervous because once COVID is in poor urban areas or urban juxtaposed rural areas, it's very, very hard indeed to get out. So what the point I'm trying to get to is that if a head of state is able to take it really seriously and a whole series of assets are made available to reduce the risk that COVID is moving around the poor population, then it's possible to move towards these COVID zero situations like New Zealand, or to get on top of COVID like Vietnam has done, or like Kerala State has done. But if for any reason there's prevarication, or if the COVID does get into really poor communities or places where people are living in overcrowded conditions, then it's very, very hard to get it out. And these then become centrifuges from which the COVID goes into other areas, and then it becomes established. It becomes almost endemic. So all of us who work on COVID and who work in public health have got to do the following really important things. Number one, to continue to make sure that the population understand the nature of this threat and how serious it is. Two, to recognize that this is fundamentally a condition of poverty and deprivation and often inadequate working and living conditions. In particular, people in factories where they cannot do physical distancing and people living in conditions where they cannot do both distancing and isolation. And then once it gets into these very poor settings, it's hard to get out, and it requires a constant and continuous and intensive effort to remove it, whether we're in poor settings in industrialized nations or poor settings in developing countries. And we're now seeing that this is the reason why people from ethnic minorities in the US, in Europe, seem to be at risk of COVID. It's because they're in these situations of deprivation and hardship. So the next part of dealing with it, as well as making sure that the people understand what's going on, as well as addressing the issue of COVID in impoverished settings, the part after that is to make sure that the whole of society takes on the task of getting on top of the COVID. And that means, of course, local authorities. It means businesses, particularly small businesses. It means especially also trades unions, universities, and other community actors, so that it becomes a collective effort. Because once COVID is into poor settings and is affecting poor people, it's very, very hard to get it out because the conditions under which they live and work are just so difficult. So let's go to Brazil. I want to talk to you a little bit about something extraordinary that's happening in Brazil. You see, Brazil is a country which is rather remarkable because the head of government has said very clearly that as far as he is concerned, this is an exaggeration. It is not indeed the threat that many of us think it is. But then in the Paraisópolis favela in Sao Paulo, which is a city that I've been to and worked in early in my life, they've actually developed local level community public health action by having block presidents who monitor the health of 50 families. And then they've had volunteers training as emergency health responders. They've got 6 residents being instructed on how to receive care by telemedicine. And in that favela, the community leader says that there are 365 other informal settlements across Brazil that are adopting these and other response mechanisms. So despite the fact that they've got a leader who denies the challenges posed by this, a leader who doesn't seem to accept that this disease is affecting the poor people in his country, we have community organizations mobilizing to act. And I think that that's what makes me optimistic, not just about what's happening with regard to COVID, but the potential of what's happening with regard to COVID to help the human family get organized to deal with other similar massive challenges. So there's quarantine centers being set up in Brazil that is trying to help make sure that virus prevention and treatment can be taking place in the favelas. Of course, it's difficult. I've been reading about the quarantine centers in Nepal, where unfortunately it does look as though there is a risk of actually amplifying transmission, because if you don't have good isolation in quarantine centers, then you can actually end up with people who've not got the disease getting it. But at least we're seeing this level of community action in parts of Brazil. And the commentary that I read said, in the face of presidential obstruction, there are discussions underway about how to tailor coronavirus responses at local level throughout the country, involving community leaders, networking with local officials, and then with all the different staff in Brazil's amazing public healthcare system, a brilliant public healthcare system. And then we've got businesses and others participating by providing support and contributing to community action, businesses seeing themselves as part of the effort. And as well as in Brazil, we are seeing this in the United States, despite the fact that there is some uncertainty on the part of the top leadership about how important coronavirus is. It's happening in the USA. I ask myself, how much is this community action happening in Britain? And yes, there is now a clear sign that the government has realized that you can't run the COVID response as a command and control activity from the top of government. You've got to be able to give it to local communities, networking together, the local authorities, local public health, local businesses, local universities, local civil society organizations, religious groups, so that you can actually approach COVID as a local challenge. Because there's flare-ups in Britain, in King's Lynn. There's a flare-up in Weston-super-Mare. There are other flare-ups now. We're hearing about them more and more because movement is starting in the UK. But it's only through having a honeycomb of local organization that you can get on top of it. So that was the message I really wanted to get through to you at the beginning of today, is that it's all about what happens at the local level. It's much harder to do this local level coordinated action if you haven't got strong leadership from the Prime Minister or the President, and that makes it very difficult. But yeah, we have got examples of good top leadership in Taiwan, in New Zealand, and in Finland, and in Germany, all led by women. And so there are signs that this can be done, but the community level organization is key. And if the top people are prepared to empower the communities, then that gives you a really good response. I thought I'd just finish by just saying, you know, I've seen the World Health Organization get a huge knocking in the recent past, and people saying it's no good, it's made mistakes, it was slow, and all that sort of stuff. And I sometimes wonder, you know, what it is, where people are getting their information, you know, and how they've got really different information from what I've got. You know, here it is that WHO has procured personal protective equipment for health workers in 135 countries, supplying 4 million gowns, 3 million sets of goggles, 11 million face shields, 50 million N95 respirators, that's the really good masks, 145 million medical masks, that's the simpler masks. And it's also done an enormous amount of laboratory strengthening, 1 million test kits in 129 countries, plus providing swabs, 8 million swabs. And then it's deployed experts with over 100 emergency medical teams all over the world, and is doing a huge open training service. You know, I am proud of that. I'm proud to be working with these people who just can give them constant effort. And despite the fact that they get knocked and abused and so on, I mean, nobody wanted this virus, but at least we've got one organization across the world that is sharing experience and is providing support. And building on that, what I want to stress is that they're also trying to learn while we're going. So we've got some quite big questions that we're asking ourselves still. You know, how much asymptomatic transmission of COVID is there? We don't fully know. Who is actually spreading the virus? Is it everybody, or is it just a small number of super spreaders? I think we're getting clearer on that. There is a rather small proportion of people who tend to spread it. Do we know who these people are? No, they don't walk around with a label on saying, I'm a super spreader. And so trying to get an understanding of that is more and more important. How long does your immunity last for after you've got COVID? It's incredibly variable. Sometimes people are immune, seems for a long time. Others don't seem to get any immunity at all. How quickly will we have a vaccine? Don't know, but it's not going to be tomorrow. That is a true mirage. So why I am so pleased to be working with this WHO family and linked to the International Monetary Fund and to the World Bank and to other international instruments is quite simply that they are helping out countries and communities in the poor world, because we're going to have to be living with this virus as a constant presence for the forthcoming future. And if we've got leaders who are prevaricating and saying, well, we're not sure how serious this is, well, at least we're going to have to get community action working together, supported by the kind of songs that Nazim is writing, supported by the kind of energy that we're seeing from community organizations all over the world, supporting by all the energy that you all represent, supported by businesses that are backing not only multinational supply chains, but small and medium enterprises, because this requires a movement that brings together 7.8 billion people in our world, changing behavior, getting organized, and learning how to live with this new threat, even if we've got leaders who get themselves all into a big muddle. So thank you. I wanted to get all of that out today. I wanted to tell you very much about my absolute excitement and delight about the prospects of community level organization and the way in which international assistance can back it, whether it's WHO or other parts of the UN, World Food Programme, and the way in which businesses and other actors are coming in and working together to make it happen. It's a movement, and it's a movement of which we're all part. So I mentioned today that we have a lot of people on. It's really great to see everybody here. And we've got a slightly different team working with us today. Florence Lasbens, who's normally here, she's on a course. And so working directly with me is Catherine Deland, but tracking the chat function, just to remind you how we do it all, we have John Atkinson working with Tui Nguyen, who's waving, and Tui is making sure that the whole communication service continues to work and is continuing to produce the videos and to help us get the songs done. And as I was just saying, we've got the second song that's come through from Nazim, which is just a beautiful new anthem on testing and tracing and isolating and protecting. We've got many people who join us quite regularly here today, and I want to greet you all with big, warm, open arms. I said at the beginning, I'm super happy because my son Tom's just had his second son, or his wife Ellen had the son just less than 24 hours ago. So I'm sort of all full of joy about that. And you will see me in a really bubbling mood. But most importantly, I'm bubbling because I'm really watching the movement of popular transformation that's happening through COVID, that's focusing on the inequities that exist in society that are revealed by COVID happening in front of our eyes. And so Carlos Madrigal from Mexico has written, saying, I'd like to hear your opinions regarding Mexico, probably the new epicenter of the pandemic. Carlos, where are you? I saw you just now, but I've lost you. Here you are. You're open, Carlos. Off you go. 2 minutes.
All right. Thank you, David. So the question, I mean, the situation here in Mexico is pretty much as Brazil. Our president continues saying that the risk is not existing. His agenda is more related to continues the campaign and continues with all the infrastructure problems that he's trying to face, and we are not doing enough tests. Our system is really, really poor, and at this point, since Monday, they reopened the city and the lockdown, saying that we have a new normality. The new normality to them is just people go back to their work, trying to have the social distance, and that's it. I mean, this day we have like the biggest number of people dying. Over 1,000 people die per day in Mexico, and we are going back to the new normality. So the president is going back to the country. He's opening schools. He's opening work. He never forgive any kind of local taxes. So people is saying that if coronavirus is not gonna kill them, hunger is gonna do it.
Yes.
So my question is, how can we keep these local efforts if the president is not helping us?
I agree it's really difficult, but look, let's just say two things that are really important. Number one, all this talk about it's hunger that will kill us or it's COVID that will kill us, this is just so unhelpful, because unless we can get the public health right, and Mexico is such a good country for public health, unless we can get the public health right, the economy is going to go on being regularly damaged by the impact of the COVID. So let's keep that logic right. And secondly, we do have to really focus on the reality that it will be community action that has to work. It's just so much harder to do it if you've got a president like President Obrador, who is saying we're doing very well. The pandemic has been tamed when you've got 13,699 deaths, 117,000 cases. You've just described the very high death figure. It's one of the highest in the world. You know, yes, there's something wrong there. So I'm afraid it does mean constant advocacy, constant dialogue. I mean, we have not to be scared by this. And at the same time, if restrictions are being limited, we're all going to have to be super alert. I hear that your Central de Abasto, your big market, is a COVID-19 hotspot. I've been hearing about what's happening in Guadalajara, just on the border with the United States, where a lot of new new graves have been added. I agree, it's a very, very serious problem. Carlos, we're with you. We're going to maintain the advocacy. We're going to keep going, because it just is not fair that you've got a leader who is saying that the problem is solved. Paul Polman is with us. Now, the reason why I really want Paul to be just speaking out is that he's somebody who has been with us on the Sustainable Development Agenda, on food and nutrition for a very long time. And he is leading a lot of efforts by businesses to try to get on top of it. Paul, I'd like to give you a particular challenge. How do we, through businesses, work with governments that deny the importance of COVID? Because business sometimes can really help to push things in a different direction. Over to you, Paul.
No, thanks, David. And I actually, it's easier to ask the questions. I posed you one, so I was hoping you give me an answer for a change. But I'm actually going off in Geneva right now. There's the rally starting at 6, so I promised my wife I'd be with her and express my strong concerns and dissatisfaction with some of the things going on right now globally. But in Mexico, Obrador had a meeting yesterday with the business community. And said, you have your facts, I have mine, which was literally what he came back with. And then, you know, there's obviously what we see between these governments that are extreme, and you've mentioned Brazil with Bolsonaro, or Mexico and some others, there frankly isn't the most respectful relationship anymore either between the private sector and the political environment, may I say. So the ICC, especially the International Chamber of Commerce, is working very hard with their local chapters to make their voices heard, to do their advocacy. But in the countries, and I think that's where the distinction is to me, where this has been politicized, which unfortunately has been the case, which is incredible if you think about it, but where it has been politicized, it is more difficult to deal with it. With that caveat now that I think more people now have the courage to speak up, especially the social aspect of the crisis that has hit a lot of nerves also in the private sector, where the S of ESG has moved up in importance, where businesses are held more accountable and responsible. What I'm more concerned about is that in businesses are desperate, 30 to 40% of the small SMEs might go out of business. So you have to take into account the desperation that is there for businesses to even stay afloat. What I'm more worried about is that as government support ebbs away and business needs to get back to survive, and you see a second wave, how business can be better prepared for that, because we will have these second or third waves, as you rightfully pointed out. And the capacity of businesses to respond after these packages run out, or when they desperately need to get back into some cash flow and liquidity, might not be the same as what we've seen in the first move. So we need to really think about that and how we prepare businesses properly for that. Next to doing more in the hotspots that you've pointed out, Africa obviously and Latin America being key ones. But I just came off the call with the Secretary General, and it's just amazing how global cooperation has just broken down. Yeah. Even in Europe, you cannot get countries to work together, you know. So one thing that we also have to think about together is when there are potential solutions, how can we prepare the ground better, that we get access for everybody, and that we don't see this going into a direction that could be 10 times worse than what we're seeing now. Because each time we think it's bad, some of these guys figure out, and they're mainly guys, as we've discovered, they figure out something that's worse. So we need to really be prepared for that. So the second wave of for the business community, and then when solutions come into sight, how can we ensure that we have a more conducive environment, I think would be two of the issues that at least we need our collective thinking on.
Paul, thank you very much indeed. Everybody, I've worked with Paul on many issues, and he's never scared of taking on the tough stuff. He really brought business in behind climate and helped to make sure that the Paris Climate Agreement came to fruition in 2015. And he's done it on nature, and he's doing it on other issues. So I'm going to really work with you, Paul, on this, making sure businesses are ready for subsequent waves of COVID and can work with governments to minimize these so that we are not going to be facing new explosive outbreaks, and making sure that business partners with the international community to ensure that solutions like vaccines and diagnostics and new treatments are available equitably and are not just simply bought up by rich nations. And these to hear somebody of Paul's stature and seniority make that particular kind of commitment is a really brilliant thing, because he'll bring the International Chamber of Commerce, he'll bring the Consumer Goods Forum, he'll bring the World Economic Forum, and he'll help the United Nations to move in this direction. Paul, we'll work with you on this, me and everybody else that I'm connected to, because these are the ultimate challenges that will define not just how we deal with COVID, but how we deal with other challenges in the future. Thank you so much, Paul, and thank you for joining us. It's really good of you. Okay, now I'd like to pick up on some other questions. Dara, how can we emphasize or refocus our communities on the threat of COVID with all else that is going on in the world? Dara, tell me what made you ask that or make that comment. Where are you, first of all?
I'm right now in France, but I'm Canadian, so I'm doing my studies in France right now. But I asked this question because right now, especially with my generation, with the younger kind of population, the movement for Black Lives Matter on social media is like really the focus on everybody's agenda. But I think that's taking away from what used to be being posted about, or used to be the conversation, which was COVID. And I think it's still really important to kind of talk about this, but I don't know the best approach. when we don't want to diminish the conversation that's happening, because it's, I think, an equally valid thing to be discussing. So I wanted to know what your opinion on that would be for all communities, but specifically for the younger generation on social media.
All right, if I was, say, 50 years younger than I am now, I would probably find it very difficult to be doing advocacy just about COVID. I would say COVID, equity, valuing nature, climate action, and other similar massive challenges are all connected. And they are all, to some degree or other, influenced by the power dynamics at local level, at national level, between countries, and then globally. And I think I would be, just as I am now, but in a different way, looking for as effective a way as I possibly can to mobilize for there to be attention to the power structures and how those work to disadvantage certain countries and certain peoples. And I don't feel personally wrong about talking like this, because my focus is on public health and equity. And I believe that it's only through addressing power structures and the way in which they actually do keep certain groups of people in situations where they're more likely to get sick, or less likely to be able to be getting help, or less easily able to negotiate their employment conditions, or more likely to be put in roles where they are expected to destroy nature, and so on. So just keep the interconnections if you can. I appreciate it's not easy, because it's nice to have a single issue to work on. But as far as I'm concerned, Black Lives Matter is very intimately linked to what we're doing on COVID. Does that make sense to you? Or do you think that I'm going into an unhelpful space? Back to you, Dara.
No, I think, like, from my perspective, I realize that, like, it's a public health matter. Like, the Black Lives Matter movement is a public health matter. But I think, like, for a lot of my peers or people that may not be studying health or may not be in the sphere of knowing, it's kind of hard to, I don't know, refocus or to integrate both. But I definitely think that integrating is a really good option to go by, but it's tough.
See it all as interconnected systems, as John, who's on the call, says. He calls them living systems, because they're systems with people inside them, and they're all so interconnected. Thank you, Dara. And you know, if any of us can help you, connect with you, give you extra ammunition in your advocacy, we'll do so. Okay. Thank you. So Vicki Doyle, I can't see you, but I can see an image on your thing. Vicki, do you want to take off your mic? There you are. Do you want to just talk about your point, please? You have the floor. Explain where you are, and off you go.
Okay, thanks. I'm based in Liverpool at the moment. And my question really is that, as related to gender-based violence, and previous studies show that there are increases in gender-based violence during public health pandemics. The reason I ask this question is I work very closely with an NGO in Kenya, LVCT Health, who do amazing work and a lot of work on gender-based violence. And they've just produced a brief, which unfortunately is showing that 1/3 of all crimes reported since the pandemic relate to sexual violence. And I think whilst everyone's talking about COVID, yeah, are we thinking about both not only the direct, but also the indirect consequences? And I think, again, when you look at Kenya, the Kibera slums, the largest urban slum in Africa, when you think about large urban poor populations living in slums and lockdown, yeah, there could be a lot of negative consequences. And I suppose my interest was really is, you know, are we looking at this data in other countries? Do we know what's actually going on or not? And what can we do to address this?
I think there are people on this call, Vicki, who are absolutely focusing on this. There are also many organizations, but it's not an issue that necessarily is top of mind for many people in government. And there are real challenges facing those who are on the receiving end of this violence, usually women, and usually it's very scary. If they report it, they're going to get further beaten. So I think it's really important that we just keep saying, this is an issue you've got to have top of mind. Have other issues high, but because so often people forget about it. So you and I might know about this, but in lots of other places doesn't. So every opportunity we have, we should mention it, and we should quote the science that we have on the incidence or thereof. I am actually going to ask my colleagues at WHO if they've got any data as well, and I'll share them on a subsequent briefing. And Vicki, if you can keep this issue right in our own thinking as we have these meetings, I'd be very grateful. And Vicki, this gives me a chance to thank you and all your colleagues in Liverpool and Nazim and so on for just constantly being with us and trying to find ways using Nazim's music and the lyrics that you and he have worked on to get the messages out. And perhaps you'll do one on what happens in lockdown, and just keep an eye on the women and give strength to the women. Because
but that was one of the reasons for the question, really, is because although the second song's only just come out and we're working on the video now, we're already beginning to discuss what the next one will be after that. And he was quite keen to do something on gender-based violence, and I think probably it would be a very good area to touch on. So again, I'm just interested to, I'm sure there are problems in many countries with gender-based violence during pandemics, but they're there anyway.
Universal, Vicki.
Yeah.
And it's great to have a really good singing man singing about it too. Thank you very much indeed for bringing it up, and thanks for being with us. And Andrea from the Netherlands, where are you? I'm looking across my thing and I can't find you. So there you are. Yeah, you're waving. Off you go. You'll sing.
Yeah, thank you so much, Dr. Nabarro. So I'm based in Amsterdam in the Netherlands, and just really curious because I know that the Netherlands was one of the first countries that decided to go straight away for the herd immunity strategy. So of course, making sure that people are not getting sick, but at the same time not having super strict rules. They're way looser than the countries around, so to say. And just very recently, I think 3 or 4 days ago, the blood bank here in the Netherlands was actually testing the donors who were donating blood recently, just to really find out how many people were able to develop already the antibodies for COVID-19. I was actually one of those donors, so I was super excited to see the updates. However, they found out it's only at around like 5% of people who were able to develop the antibodies up till now. And of course, that was quite surprising because the hopes for the herd immunity were that's going to be way higher by now. And therefore, I'm just really curious to hear your view. Is herd immunity strategy at all a good strategy to explore, or what do you think?
So, gosh, this unfortunately opens up a whole load of issues, and I'm going to be quite brief because I want to hear others as well. So let's be super quick on this. Andrea, first of all, how many people get COVID without knowing, i.e. how many people are asymptomatic? Do you know there was a bit of a controversy yesterday because during a press conference, the WHO lead person on this gave a response to a question, and it's led to big reverberations because the WHO leader said, actually, we don't think there is very much asymptomatic COVID going on in communities around the world. Rather in keeping with your figure of 5%, I think WHO also believes it's a low number. So there's not much asymptomatic COVID. That means that hoping that it will be possible to have herd immunity building up quickly is unfortunately a strategy that will not work. And I think everybody is saying that instead of trying to await the situation where everybody has natural immunity, instead we have to be able to find ways to live with COVID as a constant presence and to defend ourselves and all those who are particularly at risk against the effects of the virus. So quite simply, I'm not surprised, and I think it really reinforces that it's the strategy of constant defense that really matters, being quick and robust when infections build up. Andrea, stay connected. If you can keep coming onto these sessions, that would be absolutely great. But what I'm going to do now is
Thank you.
Really lovely. I'm going to invite a couple of people to comment on what's been going on. First of all, I'd like Scott Knox, who's sitting in Canada, to comment on what Dara said. Scott, quickly, you have the floor now.
Thank you, David. Yeah, Dara, I wanted to comment on what you were saying because it's something that I'm working on here. So I work for an organisation called the Institute of Communication Agencies, and we represent the advertising, media and marketing and PR agencies of Canada. And one of the things that we've noticed is that very typically of my industry, and I'm sometimes wondering why the hell I work in this business, but what I'm noticing is that brands switch on and off various things and when particular instances occur. So for example, you had lots of brands doing lots of activity around COVID-19. We started with a wave of the let's put lots of tearful nurses on some communications and pretend that we give a shit. And I'm going to get shot for saying that on my own behalf of my own industry. But then what has bothered me greatly is a lack of foresight with brands, particularly in Europe and the United States, where what's happened is that the Black Lives Matter issue has done two things. Firstly, it's taken COVID-19 off of the brand communications agenda. But the other things that it's done is, and many of them, including global giants like Verizon, have decided to switch off their Pride communication during the month of June. And what I'm arguing for, because I founded an organization in the United Kingdom that's now in different parts of the world called Pride AM, which is Pride in Advertising and Marketing. The thing that bothers me within this is that we need to be focusing on intersectionality. That's the word that I keep using with all of the industry across the globe. And that is, you can talk about Black Lives Matter and you can talk about its intersectionality with LGBTQ. For example, the LGBTQ gender tends to be very focused on white gay men. So therefore, what is the racist implications within the Pride movement across the world? And we need to talk about that. And so the reason I wanted to respond, and David, thank you for letting me do this, is because I think our narratives we're seeing, both from governments and from brands, is keeping things at toe deep. They're very, very simple, when actually the intersectionality of what happens with poverty and LGBTQ and gender and et cetera, we can, and your generation is very capable and clever enough to understand intersectionality. So we can talk about COVID-19 in conjunction with race. We can talk about COVID-19 in conjunction with LGBTQ. And the fact that our governments, our media and brands are not doing this is slightly insulting to our populations. So I would say that what we can all do here, but particularly you as somebody who's jumped in front of us and talked to us about this issue for the people you're connected with, is intersectionality. Talk about where these issues cross over. And that will delight people and that will get people active, because switching from one issue to another is not the right thing to be doing right now. So David, thank you. But and forgive me for slagging off my own industry, but I'm trying to push these lovely global corporations and ad agencies in the right direction from little old Toronto. But thank you very much.
Thank you for calling in, Scott. I'm going to come quickly to Robin Gorna, and then I'm going to talk to Rojan Dahal in Kathmandu. Robin Gorna in Brighton, who is going to pick up on what we heard from others who were talking in the presentation just now. Robin, please.
Thank you, David. And sadly, I'm sitting in central London where I picked up an answer.
Oh, sorry.
But usually living in Brighton or Cape Town. And I also did other
ones. It's not so good for some reason. It just suddenly, you moved or something moved and suddenly it went all less strong. So if you could keep close to the mic, that's absolutely beautiful. Thank you.
Great. Is that any better?
Perfect.
Super. So Dara, I also wanted to say intersectionality, and Scott said it extremely well, so I'm not going to repeat what he said. But prior to acquiring COVID-19 myself, I'd been writing a lot about the connections between COVID-19 and my 35 years of working in the HIV response from a feminist perspective. And I think there's a huge amount for us to learn, not just from the medical and epidemiological aspects of previous pandemics, but also very much from social and behavioral responses. And one of the articles I was writing was about the whole impact of COVID-19 on Black and minority ethnic communities here in the UK, which we're now gathering more and more information about. And ironically, I think both COVID-19 and HIV were treated as equal opportunities viruses when of course they're not. They follow the fault lines of discrimination and fragility in our society. So I think that intersectionality is really important, and a gendered response is hugely important, which also I wanted to pick up on Vicki's point. I advise a global movement called Women for Global Fund that we set up about 7 or 8 years ago to work on gender equity and the Global Fund to fight AIDS, TB and malaria. And we've been really pleased to see that the Global Fund has stepped up rapidly and allows countries to reallocate 5% of their current funds to COVID-19 responses and is setting up new funds. And so Women for Global Fund has been advocating hard for funds to be available for GBV services, where we do see these rises in domestic violence and sexual and gender-based violence, and also for the stockouts that we're seeing in the sexual and reproductive health services, where we're seeing in some countries abortion services no longer being essential. So there's a whole raft of issues from a gender perspective that are being exacerbated. And I think I put a couple of the guidance notes in the chat, but the Global Fund has done some really excellent thinking on human rights and COVID-19. And I've been learning a lot from colleagues around incarceration and how to work with people who are often pushed into a sheltered setting, potentially against their will. And so how we can really work at that societal level with communities. But yeah, I also wanted to say intersectionality. Finally, just to say, I believe WHO has produced some guidance already on the prevalence of gender-based violence in a number of countries, and there's definite rises in most continents. Over.
Thank you very much indeed, Robin. It's good to see, just if you don't mind me commenting, that you're beginning now to shake off the impact of your horrid COVID. And it's good to see you there and looking strong. Now, another group that does tend to shift priorities very quickly from almost 1 year to the next is the donor agencies. And Rojan was going to briefly talk about the challenge of donors driving policy in his country, Nepal. Rojan, we're running out of time, so could you do this as quickly as you possibly can? Open your mic up and just make the point that you made on the chat. See if you can connect with us. Here you are, Rojan. Namaskar.
Namaskar, sir. Thank you for providing me an opportunity to discuss about the policies and the plans provided to the government in developing the budget. What happened is that the instructions provided by the big donor agencies are not based on the ground reality. It largely depends upon some of the mathematical calculations based on the table somewhere in the developed country. But in the reality, what happened is that it doesn't connect the country specific challenges. So as a result of that, most of the program that has been brought do not resembles or do not provide the intended output. So this is one of the challenges that is seen in developing country like Nepal. I think these agencies should focus on the homegrown, and it has to be tailored based on the expertise they have, because the problem we can get from that, but they can take that ideas and make them more sharp, more workable, because that work. But if we try to develop means what works for developing countries from the developed country view, then in the reality it may not work, what I have observed during this period of time.
Thank you so much, and super important point. Thank you for staying up late at night and telling us, please listen to what is coming from the countries. Please don't impose some external perspective. I'm going to just invite a couple of people to make quick comments. Chris, Lara, you're there. I know you've got to go off. So just in 2 sentences, share your message loud and strong. Chris.
Yeah, hi, David, and hi, everyone. Can you hear me well?
Yeah, you can.
Yeah. Yes, okay. My question is about this new concept that everybody's hearing about, the Great Reset, launched by the IMF. And just briefly, I would like to know what you think about this, if it's this synchronized effort of the global community, the international community, and more importantly, how much stakeholders are being involved in designing these plans.
So that's one of the things that makes me quite nervous. And I'm just wondering who's decided where the reset is to. I listened to some announcement about it last week. For me, there's a lot of things that have to be corrected to actually reflect the needs of people all over the world, the inequities that exist, the human rights violations that exist. And I very much hope that this so-called reset is actually going to be based on the realities of people's needs everywhere. Do you agree, Chris?
Absolutely, and definitely this is something that we continue talking about.
Please, we've got a chance to work on this because I'm super nervous about it. Iman Ahmed,
Thank you.
You're about to go to a meeting with 25 youth community reps from Sudan this week. You're in Cairo at the moment. Just let's hear from you very quickly. Iman, you have the floor. But you're very silent because you're on mute. And I'm going to try to, yeah, you're on, off you go.
Can you hear me now? Sorry about that. So thanks for the opportunity and for the chance to meet with you also a few days ago. I think it's a coincidence that I have recently reached out to some youth groups. It hasn't been easy, but my friend in the middle has come back with an astonishing proposition that she has gathered around 24 persons, youth leaders from the communities who are already working on the front line and in COVID-19 response. So she was just coming back shyly and asking, do you think you can accommodate everyone in a Zoom meeting? And I said, wow, this is impressive. So I need to really be prepared for that. So I was impressed with what you have just started the meeting with, and hoping to get some concrete take-home messages for my meeting. Thank you.
So I'm certainly very happy to offer you my own thoughts, but do keep focusing on this concept of intersectionality. You know, that is just so valuable, because then we move from campaigning about one issue and we start to link things together. I'm going to ask Annie Feltham in a minute to talk about, to close us, but I've got two speakers, just to talk a little bit about connecting things together in her local community. It's beautiful what she's saying. But let me just ask Catherine Cunningham, very quickly, in one sentence, could you just make your point where you are, from where you are? You're talking from the west coast of the USA, but you're focusing on one big issue about the relationship between health and nature. Catherine. Are you there? Cunningham. Oh, I think she might have gone to another meeting. Okay. Annie Feltham, you're talking from Colchester in England, and you've actually, it's rather nice what I think you're going to say. So you have the last word now, and before we do a little goodbye session with everybody. So Annie.
Thanks, David, and congratulations again. Yeah, I think I get very gloomy sometimes because we have a government who is not systematic. I think I'll leave it at that. So it's all of the stuff that we're doing locally. One of the things that it's so interesting about sitting on this group is that we just hear of all these different things going on. But the opportunities come up in really surprising ways. So when Vicki was talking about gender-based violence, incredibly now, if you go around our chemists, there's a sign for women who who are at risk of domestic violence, saying, come in, there's a safe space here. And, you know, a few months ago, we'd never have had that. And so there's a sort of a thing about serendipity and turning serendipity into something which is more systematic. And so I'm really interested to learn from all of you, because there are some generalizable lessons here when we're going through a similar set of difficulties. And I think, you know, even though our environment seems so really different, it is really enthusiastic. So I'm really pleased to hear David saying he's getting excited, because sometimes I sit here and I think, blimey, this is difficult. And I think if we can help each other, that will be great.
Thank you, Annie. And just, so here's what I want to do. I want to just go around and really say goodbye to each of you personally. To Andrea, thank you for joining us from Amsterdam. Dara, thank you for joining us and talking about the challenges faced by young people. Paul, thank you for joining us. You are become such a kind of a figurehead for the community of people who've really been hit hard by their COVID. And I was just feeling such joy that you've had the courage to speak out about it. Karen, nice to see you again. Thank you for joining us. It's so good. Robin, as I said, great to see you well. Karen, thank you for joining us again. You're out in the wind somewhere. Very much enjoyed your comments last time, and stay connected. Iman, you know how brilliant I think you're doing, bringing together the diaspora for the people of Sudan. Arnie Cartridge, thank you for all you're doing. I saw Maxence just now. There he is. Wonderful to see him. Arnie, great to see you. Working, bringing business to support smallholders all over. Vicki, thank you again for the songs with Nazim. Carlos, thank you for helping us to understand the challenges in Mexico. You know, we are in solidarity with you. Twee and John, thank you so much for what you do, and others on the group as well. Julian and Catherine and everybody in our team. Magali, I see you there as well. And I'm sure there are others and I've missed you. And Florence is here. Christina, thank you for all you've been doing on the food systems dialogue. It's absolutely beautiful. Tracy, welcome again from Vancouver, and all the work you've been doing helping us focus on the homeless, a community who really need our help. Josephine, thank you for being with us today. And I saw, by the way, your Uncle Felix was on briefly. That's great. Carlos Quintana, thank you for joining us again. Super. Sarah Phillips, as always, it's gorgeous to see you here. Wonderful. And here you are, you're lighting up somewhere. Very, very good. And then Polly, thank you for being with us. Rajan G, I'm so grateful to you for continuing to send me messages. And I've been following up, trying to get more test kits to Nepal, and reading some of the controversies and challenges that are faced in trying to get people in Nepal to get better supported. Noah Lee, thank you for being with us. You're now somebody we get used to being with us. It's great. And Emerson Rogers, thank you for joining. Michelle Matter, Jay Clary, Charlie, Annabelle Ross, lovely to welcome you here to us. And there are others who've been on and who've dropped off, with masses of affection and a sense, as Annie said, that actually it's not just serendipity. It is a movement underway, but it's a movement that has roots in so many different communities, and it is part of, and we don't know how it's going to evolve, but it's part of an extraordinary process of systemic and systematic change, and we're in it. But as I say, none of us know where it's going to go. That's one of the most beautiful things about this way of working, but it's great being in there. So thanks again, and please, we'll be connecting again if you want at 8:30 European on Thursday, or otherwise it's this time next week. And don't hesitate to be in touch with any of us if there are things that crop up in between, and you'll be able to find us, but using the chat is the best way. So with that, a great big bye-bye.